What's up, everybody? Welcome back to the channel. Big D, Derek Lambert. Thanks for joining me. If you're having an emergency or something, of course, you know to call 911. But if you need to speak to someone or you're trying to reach out for help, I keep my number here for you guys to be able to reach out to me. Shoot me a text. I'm Pacific Standard Time, in case you're wondering. Shoot me a text. It doesn't matter who you are. If you're a loved one, someone who's in active addiction, you know someone who's struggling, and your family member, whatever, feel free to reach out. I'll be here to try and help support you the best I can. We're going to be talking to Dr. Faried, Banimahd, and he is actually a doctor out of California. He's got his MD. And he is going to be discussing harm reduction and also what is addiction? Is addiction really a thing? Is it a choice? Why do they call it an addiction? And delving into that matter pretty deep. I've got more videos to come from him. I just want you guys to understand this is a medical professional who's out here to try and save lives. Me and him may not agree on everything. So be an open-minded person when you listen. You may disagree. That's okay. But what we're here to do is try and educate ourselves and see and understand why the professionals think the way they do. I hope you guys enjoy this. Like, subscribe to the channel if you like the material. We're going to bring out more interviews. I'm looking into possibly interviewing other people who are other YouTubers and people who've been, if you will, through the struggle of addiction and what it's like getting through that and how it is now. So I love you guys. Thanks a lot for supporting me this far. Derek Lambert, let's do it. Dr. B, welcome back, brother. I'm glad you're with me again.
Good morning, Derek. That was a fun shoot, and had a lot of fun, and I couldn't wait to do it again.
Absolutely, absolutely. Thank you so much for joining me. Let's get right into this then. It sounds to me that you've done a lot of research on trying to prevent deaths, trying to help people who are out there that are trapped in this thing we call the disease of addiction. Some people call it a choice, and I think we're going to talk about that at some point here too as well. But number one is when people are stuck and trapped in this vicious cycle, I, for one, know for a fact what it's like within the context of being in active addiction. We hurt ourselves. We do things we would never have done. We would never intentionally mean to do. We end up with diseases. We end up with limbs having to be amputated. Lots of things happen to people who are stuck. So my question is, what is harm reduction? What is this idea that you're talking about here, and how is it going to help us?
It's a great question. And I don't know where to begin because this is a semester's lecture and discussion, and so I'll break it up into a couple of things. Number one, the idea of harm reduction, there's no single definition, and what sometimes bothers me, and I try and straighten people out, like right now in Orange County, there's a big initiative of handing out Narcan to prevent deaths. And everyone's got that little buzzword, they keep talking about harm reduction. Yes, that is harm reduction. That is a small sliver of harm reduction, and it's important. Harm reduction, I gave a lecture at the Department of Public Health a few months ago. I mean, if you talk about it, if you think about it, every single individual attempts harm reduction for their diseases that it applies. For example, when an alcoholic decides, yeah, I drink a case of beer a day, but I'm going to start to try and drink a 6-pack a day. That's harm reduction. And what it's doing, it's mitigating all of the problems that come with the primary disease, alcoholism, and trying to prevent it through approaching the secondary issue. For example, he might be a guy that likes to get in a car and drive, and he knows after 15 beers, he really can't drive. So he's trying to apply harm reduction to himself by drinking only 6 beers so he doesn't kill himself and the other guy. So he's dealing with the secondary issue without dealing with the primary issue, and I'll tell you why that's important. I'm going to go to another harm reduction concept. This stuff goes back 4,000 years. There is evidence and stories and data we have in China, for example. There was a province. All of the drinkers would go to a tavern. In the winter, they would walk home drunk, slip down the embankment, and hit their head at the bottom of the river and die. So the local government attempted to mitigate this by banning alcohol. Okay? And it was, they couldn't get people to stop drinking. We already know the story of Prohibition. So what did they do? They put a fence up next to the embankment, and deaths went to zero. What does that do? It doesn't stop the alcoholism, but here's what it does. It saves the guy so you can address the alcoholism later. You can't treat a dead guy. It gets a man home to his family so he can go to work the next day, provide for the wife, provide for the 12 kids, and you are starting to mitigate the consequences, physical and social and psychological, of the primary disease by hitting up the secondary issues. The big kind of post-modern blow-up of this was with AIDS, HIV, drug abuse, guys in San Francisco and New York that were IV drug users. That's where it sort of came into prominence in modern times, and it worked by giving clean needles to guys that were HIV, and it stopped the spread of HIV. Now, since the 90s until now, we have an incredible amount of evidence. Now let's just go to substance abuse, IV drug use, that harm reduction not only saves lives so you can get people in treatment long enough, well, it also helps getting people in treatment, because every interaction and every engagement with the addict is an opportunity to build a rapport, give them hope, empower them, give them a safe environment to be able to interact with you, and you save them to live to fight another day. Now, a lot of people say that's very progressive, and one of my colleagues and I joke about this. There's nothing progressive about this concept at all. We have, and if anybody ever wants data, we have so much data that it's ridiculous that it saves lives, decreases the impact on the system in terms of health costs, social costs, incarceration costs, and the ultimate harm reduction is putting somebody on methadone or Suboxone. We know from data that putting people on methadone decreases crime, decreases overdose deaths, decreases hepatitis C, decreases HIV. I mean, just crime is a big deal, and actually helps people. They all end up scoring better on their psychological tests of social functioning and responsibility. So it's a given. There's no controversy. If you're interested in treatment, well, harm reduction should be a large component of your approach to substance abuse, which is a chronic care approach to the disease. I hope that helps and opens up the discussion. I mean, we can go a lot more detail, but I want to give a big picture here.
You brought up something very important. I can only speak from experience when I say this, that I know exactly where you're coming from, that we're gonna self-destruct if we don't have avenues within this addiction that we're actively in protecting us. Now, you mentioned disease, and I figure, why not nail the thesis on the doors of the church, so to speak, here, because there's a huge, even to this day, it's still argued even to this day, that disease is not what it is. It's a choice, right? This whole addiction is just a choice. And, 12-step meetings talk about it being a disease. And the medical handbooks, it's a disease. And I've had people go, you need to educate yourself because there's no evidence. Like, you couldn't do a blood test or look at something and say, here is evidence that this is an actual disease, such as diabetes or something of that effect. And I always tell them, I'm like, it's weird because I am not educated on this, but it does appear to be a disease. Why are the the professionals and science as a whole consider this a disease? Can you explain why, and why this is not just some willpower choice?
When we say something is or is not, I don't want to get too heady here, but I want to kind of abstract from that, and instead of saying something is, which philosophers call an ontological status of something, I want to make it a little more abstract and just say, let's apply a conceptual model. That way it's not is or is not. And so what I'm going to say, well, let's apply the conceptual model of disease. And the next question is, why? Well, here's why. Because can I get outcome data? Will it make me be able to predict the course of something? Can I intervene with pharmacological or psychosocial intervention to get outcome data. So that means, okay, so you have the disease of hypertension. Let me give you this pill. The blood pressure should go down. I'm putting it very simply. Does it go down? Yes. So having high blood pressure is pathophysiological, is pathological. I'm going to give you this medication to make it normal physiology. Yes. So what we're going to do is apply the conceptual model of disease. Now, you could say, hey, that guy has diabetes. That's easy. I can pick out all of these markers, physiological markers that are off, and I can give certain things and it fixes them, and that's all it is. Here's the problem, and here's what people are missing. Actually, guys that do this understand this. All diseases are a function of the environment you're in, even things you don't think are so. And let me give you that example of diabetes. If I have a whole bunch of, let's say, a certain group of Native Alaskans or Native Americans that grew up in a certain environment and they've been living there for 1,000 years and they've been healthy as can be. Now I take that group of people and move them into, let's say, modern society or a different continent, different environment. All of a sudden, all of those people are suffering from hypertension, diabetes, heart disease. That clues you in that a disease is not just the disorder of structure or function in a human being or an animal or a plant without any external influence. So the point I'm trying to make here is all diseases are a function of not just your internal genetics and physiology and biology, but the environment that you are in. That's why we have public health research to see, why are these guys getting this cancer? Well, you put them in this environment and there's all this toxins and they get this cancer. Keep that in mind. Now we take it to something like addiction. Well, this is also a disease because we do have a lot of physiological secondary markers, which is MRIs, functional PET scans, some genetic data that tells us this is a disease. But it's a very complex disease because unlike something like, let's say, a cancer where you put them next to this factory and they all get cancer, it has a very rich and complex psychosocial influence that makes this disease worse, better, or even happen. So that's why there's a complexity to it. And I know for a fact that I change those environmental influences, and or if I give a medication, I can predict the outcome of that disease in a population. That's why we need to, it's not a disease, we can, instead of saying that, I like to say we can apply the disease model to addiction as a chronic disease that has relapsing, remitting course that we aim for absolute remission, and the environment has a very complex influence on it, and it's so complex and it's wrapped up in so many biases that have to do with our cultural backgrounds, whether it's religious background, whether it's politics, whether it's public policy, that it imposes the idea of, hey, that's your fault, it's your responsibility, it's your choice. Remember, things like schizophrenia, bipolar disorder, there was a time you might be put in prison for that. There was a time you might be burned at the stake for something like that. Today, it is a disease, and there's an advocacy of mental health for compassionate, benign, clinical care to get these people to where they want to. Now bring that to addiction. Are we not doing the same thing? People are being ostracized, they're being marginalized, they're going in prison by loads. If you look at the 90s drug laws, when it started incarcerating with the heavy incarceration for non-violent drug crimes. Isn't this the same thing? I have psychosocial factors that I can point to that can make your life better. I have pharmacotherapy that I can point to that can make your life better. And I can tell you, there's no addict, once they've gotten to the severe points of their addiction, that tells you, I like this, I choose this, I want to do this. Does that help?
Absolutely, 100%. I totally agree with that, and I've experienced it myself, because that always boils down to that whole I guess you'd say there's a philosophy idea that's surrounding this. If people like to say, well, is there free will? Is there no free will? And you can start getting into that stuff. And then you have, a lot of people who are going, well, really, there's no free will, or there is, and you listen to that and people go, this is a choice. Well, if you kind of look at these things, not only in these philosophers' eyes, so to speak, but also having the experience, if there is even a choice in all this, I always describe it like this, and maybe you can elaborate, is that the choice is like 1% chance that I have the capability somehow in my mind to even choose to not do this drug, and 99% of my brain is saying, you have to do this drug. And so what are the odds of me not doing it versus doing it? It seems so improbable in my brain, it's not really a choice, even though people like to dangle it there and say, just choose to do this, just choose to do that. And it really makes me feel like, people don't understand this, and those who do are usually ones who've experienced it or are medically educated in this field. And I also want to mention when you said, they've ostracized and imprisoned people like us who are dealing with this disease. You also have those who are trying to, if you will, harm reduction, back to our original point. They're going on to another medication, and now they're being ostracized by the very people who've endured the same disease by saying, well, you're not part of us because you're taking something that, is chemically involved that makes you not clean. And I always tell this one thing on that is I said, someone who doesn't take a drug, they call it a dry drunk, someone whose emotional behaviors are not acting right, but they're not taking anything, yet their behaviors aren't right. They're technically, they call it dry drunks, or they're actively using, but they didn't take a drug in their behavior. You don't even have to take a substance to be in the wrong path in your behavior. Doesn't it really boil down to behaviors at this point, and that the other stuff is really, I guess you'd say, symptoms of the behavior?
You mean that is the addiction a symptom of the behavior?
Technically, yeah. I mean, because it seems to me that the behavior is what we're really aiming at trying to fix.
Yes. So I always call it, I always go back to my thing. Getting you off drugs is easy. Let me put you in a jail cell and I'll keep you off, lock you up for 2 months. I'll get you to stop using. Getting you, I call it, you call it dry drunk, I call it sober mind, sober decision making. And the addiction that really takes over, it's not just a drug, it's all of the decision making processes that, again, that frontal cortex with its connection with the midbrain is severed. And what you want to do is start to rewire that client, that patient, into making sober decisions and sober choices. And that means all of those choices that are wrong and geared towards instant gratification. And this gets very complex because this goes into that issue of the society that your recovery is couched in. If your society doesn't make sober choices itself, if its laws aren't sober, if its consumption, if its marketing, if its values are not sober, how am I going to get you clean after I get you off the drugs? You remind me of a thing somebody brought up to me last night. They gave me a name, something Jenner. I guess she's one of the Kardashians. She's 20 years old and she's worth $1 billion or something. And you guys probably know who I'm talking about. Odie, do you know what her name is? Kylie what?
Jenner.
Kylie Jenner. Someone brought this up, and this kind of fits into what you're asking. I'm giving one small example. And I was like, well, why is this 20-year-old worth $1 billion? And they're like, I don't know. And so we look it up. What did she produce in this world that's worth $1 billion? So we look, I look it up, and it says she's an actress. No, it says she's a model and a celebrity. And so you're like, wow, it's not her. Anybody will take $1 billion, but it's the society that promotes her to get to $1 billion, and that society is every single one of us that promotes whatever that she does for her to be worth $1 billion. And I'm not saying she's a bad person. She's probably a great person. I don't know. I don't even know her. but you want to give me $1 billion, go ahead. And so my point is every single one of us is responsible for that kind of not sober thinking and approach to make one person worth $1 billion who has really produced nothing in this world to be $1 billion. I guess the whole world follows her and will pay whatever it is for her to get to that point. And that is no different than addiction and a not sober mind or a dry, drunk, whatever it is that you said. And my problem with my patients and my kids and my IOP is, what do I do after I sober them off the drugs? How do I get them back into a society that actually promotes that kind of behavior, whether it's drug abuse or making somebody who's done nothing in their life worth $1 billion? Does that make sense, Derek?
Absolutely. Thank you so much, Doctor, for answering these questions. And I think we had a good one here. So do you have any closing statements you'd like to make, sir?
No, this is a wonderful, you ask these great questions, and a lot of these are things I would like to discuss at length and give a lot more discussion about it and couch it in a much bigger framework. But thank you so much for having me on. That was awesome. I always enjoy this. You get me going to talk so much, and I try to really sum up like something that would take hours into a few minutes. But I hope people enjoy it and give us some feedback.